I think a lot of people don't understand the concept of time in the medical field. Time is always the essence. People are always in a hurry. And on one hand, there's a push from insurance companies to have shorter stays. That's correct. But many times it's not the push from insurance companies, it's a push from doctors who feel the urgency to act and do something now. Or it's a push from nurses who think something needs to be done now. Or it's a push from patients who think something has to be done now. One thing I've learned over the past few years from talking to surgeons is that time is a good thing. Apparently, a lot of people can improve without surgery, and it seems like that's always the right answer. If you could potentially forego an operation, that's not a bad thing. And I think it's a very difficult concept to understand because they could do surgery and fix people right away. I cannot. They could cure people right away. I mean, a few hours, but I cannot. I could just give antibiotics, IV fluids, some medications, and hope for a turnaround, a good outcome. So, why is it that they don't want to do surgery? It's not that they don't like doing surgery, they do. They went into this business, into the trade, because they love operating on people. Why else they wake up at 3 or 4 a.m. excited? They wake up to do surgery. It's a love of their life, if not the love of their life. They put up with so much horrible stuff because they want to be in an operating room, and that makes it all worth it. It's like a love story. My friend really taught me the value of time. He's a surgeon. And I often talk to him about cases I don't understand. Why do surgeons don't want to take the patient? Why do surgeons do this or that? I think the first rule of thumb is surgeons aren't heroes. Non-surgeons, we medical folk who don't do stuff other than give meds, to us, they are heroes. They do amazing things. They make things possible. They make things recover when otherwise it was impossible. I think most surgeons think they do amazing things, but I think the reality is they're not superheroes like Superman. They don't fix impossible situations. They deal with constraints. And that's the reality, right? So if somebody has dying gut inside of them, I thought the solution would be cut it out, fix them up, patch them up, and send them back to me. All good. But no. Often the solution is cut out the dead part, poke a hole in the belly, stick the rest out through there, and call it a day until later, which is usually a lot later. Huh, that doesn't sound optimal. So the idea is you're going to get fixed up, but now you have returned my car. And while it's still drivable, I need to basically have a bucket under it whenever it's parked, so because it's to catch all the oil dripping out. That just isn't ideal, and nobody likes living with ostomy. Your feces are coming out through your belly. If it leaks, it is stool leaking all over the place. There may be a smell if it's not sealed well. You have to empty it because, yeah, you can't really empty it through your bottom because that doesn't work anymore. Yeah, not ideal. And then there's complications. There's many things that are just high risk for complications, so almost guaranteed complications. Like operating on someone's belly who's already had 15 operations, you're just guaranteed to have a complication. Then what do you do? Or if somebody has fluid in their belly already and you operate, yeah, you're going to have issues there because that fluid's going to get infected. Then what do you do? There's a long-sightedness to surgeons that I never realized. They think about the future. Will they have to reoperate? That's not a positive thing. It's not like dentists who love for you to come in for extra cleanings every year because they make money. Insurance only covers two, right? Yeah, no, we don't really want to reoperate. It gets messier every time. We don't really like leaving you with issues afterwards because quality of life is important. Otherwise, why do we do stuff? And that's the whole thing about time. It's ironic how the surgeon believes more in the healing power of the body than the medical doctor. They oftentimes believe they just need a little bit more help. I had this case recently, a lady with Clostridium difficile colitis. It's pretty significant. It was going downhill, but she improved with antibiotics. Then she started having more belly issues. I did a CT scan, and there and behold, she had perforated. A part of her gut had opened up, and stuff came out of her colon into the rest of her abdomen. Not good, but it's what? It's sealed. Oh, that's a good thing, right? So the body has walled it off, its own protective mechanism. So not the worst case scenario. So what are we going to do about it? Well, give her more antibiotics to cover that, not just for the Clostridium difficile. Don't have her eat. Oh, she's not, her gut's not working, the rest of it? Yeah, put a tube in, suck it out to give her gut an easier time so she doesn't have to vomit it up. Okay, let's just keep on going this way until she improves. Why? Because we don't want to do surgery. It's not that they don't want to do surgery. Again, you have to assume, presume, but this is correct. They'd like to do surgery. The residents want to do surgery. It is because, what? It's going to lead to a bad outcome for her. They're going to have to take out all her colon. It's going to leave her with her intestines, her small intestines coming out her belly, which she already experienced before, and she's going to hate. And what else? Oh, yeah, you're missing that colon. You know what the colon's role is? Why cholera and things are so bad? The colon's role is to absorb fluids. So she's making some diarrhea coming out and get dehydrated from that and be hospitalized every other week. Or somebody arranges for IV fluids, not in a hospital. But either way, you're not going to be able to live the life you did before. So while I thought it'd just be a fix, you fix it quickly. She's not just lingering around in a hospital for a while. It's not the first time. Remember in residency, I saw an old lady. She had a perforation with a colonoscopy. She was in a hospital with IV nutrition, miserable. The idea is that we'll give it time to heal. We don't want to go and operate when we don't have to. And the big thing is how you view time. See, I think a lot of us medical folk view it as a ticking time bomb. She's going to crump. Something bad's going to happen. I can only do so much. But the surgeons don't view it that way. They view it as any day this patient survives not undergoing surgery is a good thing. We keep including days, and it keeps getting better. So why don't we just keep on waiting, right? And that's the thing. Medical folks don't seem to get a concept of using time, right? I mean, it's actually sort of contradictory. Some people use time, some people do not use time. And I would say for me, the biggest issue is medical folks think they could do stuff quickly. The nurses think you should do stuff quickly. The surgeons Do not, right? You may page them for a high blood pressure. By the time they get back to the nurses, an hour or two, the blood pressure actually may have changed, may have come down by itself. But for medical folks, the nurses want an order, a medicine, something done right away. When in fact, the truth is maybe just waiting a few hours and seeing what happens if it comes down great is actually the better solution. I would say, dare say it is almost the better solution in every case. But what's the issue? Well, you could do something about it. See, nobody can push a surgeon to do surgery. But medicines, we think, they're fine. Just push the doc. He'll give him medicine. And that's fine. He'll get better. And that's the issue. We kill people dropping their blood pressure. We cause strokes. We do all sorts of bad stuff. What would have happened with their high blood pressure? For 99.9% of them, nothing. Especially when it's like 180, 200, no big deal. Speed, efficiency, if you will. Good for the staff, but bad for the patient.